Hello and welcome to another little short video on a wellness moment. I'm Dr. Ed Traum of 3D Integrated Medical. And I thought today I would spend just a couple of minutes talking about a case I have had. A case on a foot. Feet are very, very high stress parts of our bodies. Honestly, I don't think there's a part of our body that undergoes more stress than the foot. And it's, in my opinion, it's a miracle that they hold together as well as they do. Most people are familiar with the term plantar fasciitis. That's when on this inside part of the foot that people start getting pain here in this archway. Typically it's in the morning when you wake up after the muscles have cooled down and they've stiffened up a little bit, and then you stand up in the morning and you get a sharp stabbing pain right here on your arch in the instep of your foot. And then it kind of goes away as it warms up and kind of happens daily. Sometimes this can become just intractable. It can become very, very painful, very chronic, and be very, very tough to fix. Some people try to have acupuncture done for it. They try to use a boot, which they'll put over their foot, and it'll kind of stretch it and hold it in this position while they're sleeping. Not very comfortable. I can't imagine anybody could do that and get any good sleep. But they don't tend to work that well from my experience. Of course, I have to be careful because in my office when I'm treating someone, it's that group of people who have had failures with those therapies and they've been everywhere else and they just want to try some fascial manipulation or other soft tissue work for it. And I can be very successful with soft tissue work. But one thing I make very clear right off the beginning is I don't typically treat the site of pain. I will look above and below. So what we have in our shin here, we have an anterior tibialis muscle, a big muscle here on the front side, and it comes down over here and it grabs onto this part of the foot. Then we have a posterior tibial muscle, comes on the back side, comes under here, and it grabs onto all these little muscles or bones right here, and that lifts up the archway. Now on the other side over here we have what we call peroneal muscles that come down here and they grab the same way and attach to certain bony parts, and that supports us that way. And then we have all these plantar surface muscles under here that kind of maintain that arch and assist with the toe off and controlling the heel strike. Complicated biomechanics. And I am not an expert in foot biomechanics. I'm an expert in fascia and soft tissue work. So I get very good results with plantar fasciitis when I work these anterior tibial muscle, posterior tibial muscle, gastrocnemius, soleus, all of these different muscles back here and up here. But I'm not going to get into all of those today. I'm going to talk about a patient whose pain was a little bit here in a plantar fasciitis type of a description, but really it was here on the outside of the foot with standing. She does a lot of standing at work, and it's becoming something that's constantly bothering her and affecting her daily activities. So she had done a lot of different therapies for it, and nothing had helped. So I have treated her now a few times, 3 times, and we addressed what we have up here called the extensor digitorum longus muscle out here on the side of the leg, and it sends tendons down here and it grabs onto these and it helps pull these toes up. I worked that muscle, and I also worked this tissue here. This is a simulation of retinacula. Now retinacula are binding ligaments basically, but they're not real ligaments because they're not holding joints together or bones together. People typically think of them as restraining ligaments where they're holding tendons down. And that's not altogether true. They do that, but retinacula are thickenings of the deep fascia around the foot and around the knee, around every joint. There's thickening of the deep fascia, and it forms itself based upon forces placed upon it. So it'll get stronger with normal gait, but if we have an abnormal gait, they'll actually thicken up and strengthen in abnormal directions. But the really interesting thing about retinacula is not that they are restraining tissues to hold tendons down. The really interesting thing is they're some of the most highly innervated fascial tissues in the body. Now that's a shocker to most people. And that shows us that you can't just cut these retinacula when, like for instance, carpal tunnel syndrome in the wrist here, they could open that up to give space to the nerves by cutting a little bit of that retinaculum. And that creates a lot of problems because they're full of nerves that tell our brain where our feet are or our hands are or any joint are, what position they're in while they're moving. So they're really, really important feedback nerves in those retinacula. Now this particular patient, with the work on the outside here, and I did work on these retinacula here and the tendons, what happened was all her pain started to go away out here, but now it has centralized over here on the side of this calcaneus or the heel bone. Now that can be problematic as well. So what we did was we've started to work on the tendons here. This is the muscle here is called the peroneus brevis muscle, and it comes down and attaches right here to this end of this bone. The longest comes down and it goes past it and attaches back into here. But I have worked on those tendons and some of these ligaments in here and the retinacula, just trying to soften that tissue up. It's a little bit uncomfortable for the patient, as most soft tissue therapies are, but it is making these tissues more pliable. So it's making the foot dynamics over here on this outside a little more mobile. So when she walks, it's less painful out here, significantly less painful out here, but now it's more painful here. So we need to address this. But the important thing is that we're addressing soft tissue. We're not just, cracking joints open or adjusting things. We're not shooting cortisone into it, and we're not doing surgery to it. We're adjusting the tone or the texture of the soft tissues. And that's a really, really important thing to address. Soft tissue work is not really curative. A lot of times when we're dealing with the musculoskeletal pains, we're not curing this so much as we are coaxing it. We're irritating it, and we're trying to coax it into becoming more pliable, more flexible. We're trying to accelerate what we call the remodeling phase. We're trying to remodel this stuff. And we do so by irritating it, basically. But that's a discussion for another video. I don't want to get too much into this. But this is that's going to be my strategy now. Now that we have addressed this stuff out here, working on the larger picture, we're going to target now. We're going to work on these big retinacula and the ligaments that are holding this area down and keeping this tissue from sliding. This is probably the cause of her pain out here. But have to keep in mind, I always caution people, when you're working on high stress body parts like feet or low backs, you have to be cautious with your prognosis. It can take some time to make a change. So keep that in mind. When you have body aches and pains, musculoskeletal things, 90% of the time, this is a soft tissue issue. Accepting trauma. Now, if you have a trauma, ankle sprain or some kind of a car crash or something like that, yeah, that's gonna tear tissue. It can destroy joints because of trauma, but that's really not the majority of cases. Most of the time, it's repetitive stress, just like walking is, and that repetitive stress keeps our tissues irritated, and sometimes they just kind of, as we get older especially, it just gets to where it hurts all the time. So remember, soft tissue aches and pains are soft tissue therapy techniques that need to be employed in that, and we are coaxing them into better behavior rather than curing them with some one-shot technique like a cortisone shot or an adjustment. It oftentimes doesn't work out that way. And that's why I have become so passionate about soft tissue work and have become an expert in fascial manipulation and other techniques. So keep that in mind. Next time you have a problem, let's talk about soft tissue technique and what it might do for you. I hope you have a great day. I hope you have a great week. Remember, health is really the only asset we have that matters. And I wish you the best. Have a great day.